Every part of the hands and feet correspond to a specific part of the body. So by applying pressure to the reflex points, it is possible to treat the different areas of the body. Then you've got the pituitary gland here and the thyroid, and then they've got the heart area there that you would work along. Then underneath that eye area you've got the large lung areas along here, and then you've got the trachea and bronchi that you would work just on the side here. Today I've got a little bit of a slightly different approach to me learning the reflex points on the feet. I've discovered these wonderful learning tools, so socks with the key reflex points placed on them. So I've decided I'm going to have a little bit of fun and use these. I've also got my backup reference point here, which is my old reference textbook, if I need to refer to that, which has very clear images of the plantar view of the feet, and it'd be interesting to see how they match with what I found with this really, which looks like quite a useful learning tool. I've not come across these before, but they look quite interesting. So I'm going to use it to really help me relearn these reflex points on the plantar view of the feet. Before we start, I'm just going to do a brief introduction to what reflexology is about. Reflexology is both a simple science and a safe and highly effective way of treating the body without the use of drugs or surgery. All that we need to be highly efficient in applying this science is 2 hands and the knowledge that you gain through professional study. Reflexology is a method for activating the healing powers of the body. By applying pressure to specific points in the feet, we can create a stimulation through the nerve pathways from the feet to the brain, similar to the principle of acupressure, where needles are positioned through the meridian lines, which stimulate an energy or nerve impulse through the entire system that encourages the body's own healing potential. Every part of the hands and feet correspond to a specific part of the body. So by applying pressure to the reflex points, it is possible to treat the different areas of the body. Reflexology relieves tension and gives the receiver a wonderful sense of well-being. It therefore can be used confidently in treating most of the everyday problems that we might consult our GP with. For example, things like migraine, sinus conditions, kidney problems, menstrual difficulties, some depression, ear, nose and throat conditions, as well as being extremely effective in treating all forms of back conditions. There are so many benefits to be gained from reflexology for both the patient and the practitioner. Very few of us perform at our best if we're sluggish or tired. A session of reflexology often has the effect of a pick-me-up. It can make you feel more positive and good about yourself. Reflexology, however, is not a cure and should not be professed to be one. Reflexologists do not diagnose illness, nor do they practice medicine. And now I'd like to start going through using this new learning tool, which, if you have a volunteer, like I do here, they can literally put the sock onto their feet, and then this will identify the reflex points for you. So for example, you've got your heart here to start with, and obviously once you learn your reflexology techniques, you can actually work these areas, but I'll do this now. But if you're looking into doing this yourself, what you need to do is do a little bit of research on the techniques, but this is a common one that we use, which is called the caterpillar technique. So you would literally caterpillar over that heart area there. Then you have the pituitary gland here, clearly labelled in a colour, which is really helpful. And you can go across that. Then you've got the thyroid underneath there. And then you've got the heart area located here as well. So you would work that whole area there. And then you can see, if you look at this, they've sort of got the sinus area marked along the top. In fact, there is one on this toe as well, but they've got the sinus area marked there, and you would work these. Slightly different technique on these as well. And in some cases you would actually come down the foot using that technique. Then on this here you've got the eye and the ear. Actually, on my reference point here, it is slightly higher. But if you're massaging that downwards, you would massage, you would cover that area. But they've got the eye and the ear here. Then you've got the bronchial tract going up there, covering over the lung areas here. It's actually very helpful because it does stop you, because you can now just focus on that lung area and then go into the shoulder area here. Then you've got this wonderful diaphragm line, which is a very good point of reference. Then you've got this area here, which is your key energy centre, the solar plexus. You wouldn't actually work over that, you'd actually push fairly hard. So you've got like a hook method going into there. Sometimes when you press on that, you can actually feel a slight hardness, and you can release that. Then you've got the stomach area, which actually comes down a bit. So massaging that round with the adrenal gland here, the spleen over here, the kidneys just underneath those adrenal glands, and the urinary tract going down into the bladder here, the small intestine over that area, the sigmoid colon going down here into the rectum here, and then you've got the heel line and the sciatic nerve, which actually goes right the way across there. And that covers all of the areas that they've identified there. Very useful just as key point areas. I think this is a really useful starting point, but I do think you need a backup reference point to make sure you're covering the right areas in the right location. And then you also would need to research or revise, if you've done this, learnt this already, which particular techniques you would use for which part of the foot. So that covers nicely that left plantar view, and very clearly covers that. I will just point out a few areas that are missing. So the brain, which is worked on the top here, is missing, and the spinal area needs to be included as well. But to get you started and thinking about where the reflex points are, it's a useful starter tool. Okay, so we've done that left foot. So what I'd like to do is just move over to the right foot. Oh, thank you. Okay, so again, we've got the heart area here, and you would use your thumb caterpillar moves, and actually you might want to come down as well to cover that area. Then you've got the pituitary gland here and the thyroid, and then they've got the heart area there that you would work along. Here you've got the bronchial tract, which you would work along. And they've got the sinuses here, which you could work on. And then underneath that, I think it's actually here, but they've got it lower down here, which is the eye and the ear. It's actually on the toes, I think, in most reference points, but their reference points has it here. Then underneath that eye area, you've got the large lung areas along here. And then over towards the side of the lungs there, you've got the shoulders that you would work. You'd actually work right on the side of the foot here as well, actually. Then you've got your diaphragm reference point along here. And then on this side, you've got your gallbladder, which you would work on there. With the liver running behind that. So once you've done the solar plexus, you would work on the liver to cover that whole area. Then you've got the adrenal glands here, just above the kidney area. And then the urinary tract, which then takes you down to the bladder. Then here you've got the large intestine, the small intestine, which is always makes me chuckle because it's actually a really big area. You've got the iliocacial valve on the side here. Then you've got the heel line going across, and also the sciatic nerve going along there that you would massage across. And a few key areas that I'm missing on here are the brain on the top of these toes here, and the spinal area, which is all the way down, and you would massage that in one go. And swap hands at some point so that you could go across where the sciatic nerve runs across. But a useful starting tool which gives you the key areas for some of the reflex points for the plantar view of this right foot. So one thing I do find with these socks, they're very helpful as a learning tool, but one of the areas it doesn't cover is actually the top of the foot, so the dorsal view. So what I'd like to do is use one of my normal reference points and just cover some of the key points that you have on the dorsal view. So we're just going to cover the right dorsal view. So let's go down. So you have the cranial nerve here. You have the teeth that you would massage along with your caterpillar move. Or for some of these, you could do a squeezing, pinching move as well to make sure you get right in. Sometimes with small toes, you have to slightly adapt your technique to actually get in and ensure that you cover everything. So that's the teeth area there. And then you've got the trachea and bronchi that you would work just on the side here. And then you've got the huge area here, which is the lung and breast area that you would work over. So that would be your lung and breast area. And actually behind that, you've actually got the ribs as well. So by doing the whole area, you would cover the ribs as well there. Then at the bottom here, you've got the fallopian tube. And then just coming up, covering the remaining areas, you've got the neck and thyroid along the base of these 3 toes that you would cover. And then also the face area is covered here as well. So whatever works, depending on the size of the toes, you could work the facial areas there with various techniques. Really depends on the individuals as to which techniques you would use to get in to some of these areas. And even the side of the neck, which is down here, you might have to vary your techniques to actually get in and do those. If we can swap and I can have the other foot, thank you. I'm just going to pop that one out the way because I'd like to do the dorsal view on this left foot as well. So just running through as we did then, starting with the big toe again. So we've got the cranial nerve along here, those teeth that we would work along, or you could be doing that move as well if you can reach in sufficiently, and the face area which you would massage through. And then you would come down underneath to do the trachea and the bronchi. Then along here you've got the neck and the thyroid along there. Then you've got this large area here, which is the lung and the breast again, and behind it, that large area of the ribs underneath that. And you would spend quite some time working these areas. With your various moves, whatever works. Particularly working out any build-up of tension in that area. Moving back down to the fallopian tube and making sure that that is worked and then connects to the plantar view of the foot as well. And that actually covers the dorsal view, and I think it would have been helpful if they'd had that actually on the top of the socks. I'm sure there may be a learning tool out there that covers that, but actually just having this reference point, this is a very good reference book, and the diagram is very clear on there as to where these reference points are on the top. So just finishing off, I think that covers nicely both the plantar view, which you've got these helpful points by using this other learning tool that I've discovered with these socks, and then maybe just adding in that dorsal view to make sure that you've got all of the relevant reflex points. And once you've got to grips with that, obviously then revise your techniques, and then you should be ready to start doing a treatment. Thank you for loaning me your feet.